Not too many tabs this time.
Oh, that's better.
Wow.
The other ones, you don't want to look at the other one.
Is it RV like with like 20s?
It's definitely 20
right
plus.
All right, mate, go for it.
So, so we're going to look over, we'll try and get that a bit better. There we go. Going over a paper that's looking at the diagnosis, prevention and treatment of common lower extremity muscle injuries in sport. And sort of going over that because, as I said, sport is on the way back in Australia, and we've seen in the national and international sort of competitions that have come back recently, there's been a big influx of muscle and tendon injuries. And so as community sports are coming back for us, where we want to be as prepared as we can be for the almost inevitable influx of patients coming through. So this is a summary by the guys at Physio Network. So we're going to have a look at that and then go over the FIFA 11 protocol. So bruises and strains account for 90% of all muscle injuries. Muscle strains are typically seen in superficial muscles extending across two joints, such as the hamstrings, the rectus femoris, the gastroc, and occur due to non-contact mechanisms. Hamstring and adductor injuries account for more than half of the injuries in football. So, and due to the unchanged incidence of muscle strains over the last decade, the study was aimed to identify, assess and grade the diagnostic tests, prevention and treatment strategies for common lower limb muscle injuries. I'm going to go straight to the results. If I can just move. There we go. So for hamstring injuries, taking off the shoe test showed the highest diagnostic effectiveness in predicting a positive or negative MRI result. So that is simply, I think, getting the subject to take off their shoe, and if they've got pain, reproduce with that, I think. Someone can maybe jump in and correct me. And then,
sure, actually.
Yeah, I didn't go over it. But pain on stretching and or muscle contraction is unlikely to add additional diagnostic value if a player presents with a clear history of posterior thigh pain. And that's since 60 or 70% of athletes could have a hamstring injury despite negative pain findings on stretching and contraction. And then implementation of the Nordic hamstring exercise showed a significant risk reduction, fast return to play and less re-injuries. So it's one of the better hamstring exercises to do. Going into adductor injuries. So a negative adductor palpation test helps rule out an adductor injury and predict a negative MRI result compared to other clinical tests. So palpating is a strong clinical test. The Copenhagen adductor exercise and the FIFA 11 Plus program showed an almost 40% risk reduction in groin injury in footy players. So that's pretty big.
And Jack, can I ask, who's actually doing that with clubs right now?
Exactly.
Are we? No. Are the clubs? No. Are you familiar with that, with the Copenhagen as well, Arby?
No, not that one.
Okay. Do you want to explain what the Copenhagen is? So because you were doing it today.
Yeah. So it's kind of like you're almost in like a side plank position, but your top leg is like leaning or like hanging onto a bench top. And so the space underneath your top leg that's sitting on the bench top, your lower leg is raising up and down using the lower leg. Yeah. So it's a challenging adductor exercise that has a few different sort of progressions, but that's the main gist of the exercise.
Okay.
All right, so going on to rectus femoris and quadriceps injuries. proximal rec-fem palpation test and resisted knee extension in a modified Thompson test position showed the highest diagnostic effectiveness in MRI prediction. A two-phase criterion base, AFL increasing running. So a two-phase criterion-based program on 18 AFL players with increased running and kicking intensity showed a return to training at 13 days and with no re-injuries. However, the time during which no injuries were observed and were unreported. So going into calf injuries, no study for diagnostic tests were included, but a soccer-specific balance program over 5 seasons was better in reducing gastroc injuries in football compared to a 6-month control period. Anyway, so there's a couple of different sort of exercises and diagnostic tests for the big hamstring, adductor, rec-fem and calf injuries. But the clinical implications of this study, it was showing that the implementation of the FIFA 11 Plus program was poor in youth football teams. However, it is the only evidence-based intervention effective in reducing the risk of those big sort of couple lower limb muscle injuries. And a lot of them is situated around the eccentric strengthening for both hamstring and adductor injuries, which is the Nordic and the Copenhagen exercises, and they achieved faster return to play times as also reduced injury risk. So if we go over to, I wanted just to sort of go over the FIFA 11 protocol. I can get out of here.
While you're doing that, Jack, just an interesting food for thought. You know, what does the research show around screening? I'm just interested to know. Well, I know, but in general, what does it sort of say around pre-screening?
Screening for like
just
trying
in
to
general.
determine
Prediction of injury.
risk.
Yeah,
it's tough to predict.
Yeah. Do you have any thoughts? Yeah, from what you've been taught, Avi, what are your thoughts around that? About things like this and preventing injury.
I don't think there's I don't think they have strong metrics for any of the screening tests.
We just got to put it
too much research.
Yeah, so that's so true, right? Have you guys heard of FMS before? Functional movement screening. Yeah. There is a whole heap of tests, and then it determines certain different things. We can look into it later, but there was a cool article that said, I think is actually rate of predicting injury was like 55 or 60%. So Adam Meekins, God love him, I remember putting a post saying, flip a coin or do FMS. I was like, which I think was kind of funny. But I don't believe we need to throw the baby out with the bathwater, to use another Australian phrase, with screening, because I think even though the evidence is definitely not the highest, we know that there's, the clinical implications can be very, very important. And particularly working with netballers and working with AFL players that we do in clinic, if we can get specific and get them working towards movement patterns that help them with their movement, I think more research will come out, and hopefully in time when they do a lot more scientific studies, they'll be able to show that. So it is important to know that the research is still a bit, how's it going? But that doesn't mean that there isn't clinical implications. Would you guys agree with that comment?
Yeah, 100%. Yeah.
Yeah, cool. And Riley, just for your benefit, like as you do gym and sports, this sort of stuff, it's important to know your research base versus, how to apply it. And we'll slowly teach you things like that along the way, which is it's something we talk about a lot. So let's go through FIFA 11. I actually haven't gone through this one in a while. I do the netball stuff so much. So,
Yeah, so I think just going through this and then sort of just having a bit of discussion about sort of how we can sort of implement and then do and sort of talk about the different ones we can do with our sort of teams. But the FIFA 11 is a 3-part sort of warm-up or sort of training for injury prevention drills. The first part is just a general running exercises part. So starting with straight line running, and then doing a few sort of hip in and out movements. So jogging, stopping on the spot, and then moving the hip in like internal and external rotation. Then with a partner, circling, running, and then circling around a partner, doing a small shoulder bump, and just sort of getting the landing from a bit of a bump warmed up, and then going into a bit of like shuttle runnings with a bit faster with some acceleration and deceleration. Part 2 is, it's got a couple of different sort of levels depending on the player's ability. So you can either go straight down the green level 1, or straight down the the orange level 2, or straight down the red for level 3. And they're all about sort of strength, plyometrics, and balance exercises. So starting with like a plank or plank sort of progressions in that first one. So doing a plank with either leg lifts or a lift and a hold. And then the next one is a side plank with a lift or a hold sort of thing. So working on the core strength and trunk strength. The next going down is the Nordic exercise. So starting with the beginner, intermediate, and advanced progressions of that. The next one going down is single leg stance. We can either with a added sort of movement in there, trying to challenge balance. Moving into squats, lunges, or single leg squats, working on the quadriceps muscle, and then going into jumping and landing type drills. The last one is a bit more of an intense running exercises. So working out a little bit harder, more of a sprint. Then we can go into a bounding or a sidestepping with the planted and cut. And that's sort of the general gist. It takes about 20 to 25 minutes. Anyone have any thoughts about that?
Yeah, I think that's pretty straightforward.
Yeah,
it's pretty much, yeah.
The only thing, it is I guess quite long. So doing it before a game warm up is to the higher compliance you have with doing this FIFA 11. If you're doing it 2-3 times a week, you're gonna obviously get much better results than just doing it once a week. Mm-hmm. And so like before a game, 20 to 25 minutes of this is a little bit longer than, because you also want to do like game specific warm up, especially for like community sport. You don't really want to be warming up for an hour. So trying to work out, I guess, which ones may benefit most, or yeah.
I'd be really interested in your thoughts on that, and especially with your lacrosse background. Is that too much? Do you think there's good stuff there? Is it that it's missing? Just gut feel. What are your thoughts?
Yeah, I mean, I think it's good. I just don't know. Do they want you to do this like every day, or like every time you're practicing, or because if it does take that long, I don't know. I mean, I guess that was probably about
sort of
the length of our warm up.
Yeah.
But like we would do like run a lap, and then kind of like a dynamic. We would do like the hip opening, closing, close the gate, open the gate, stretching, dynamic stretching kind of stuff. And then, but not any, like the part 2, we didn't really do much of that ever. Just because I feel like, I mean, I think they're good exercises to do. It's just how realistic is that if you want to also like be practicing your sport. Kind of depends how long you're practicing for, and like what level, I think too, because if you're also just playing like if you're playing at the college level, you probably might have more time to spend on this, rather if you're playing like adult recreational league where you're meeting up once a week for practice, like, do you want to spend half the time doing this warm up?
That's so interesting. And I always get concerned when I agree with you too much, Avi. It's weird. But we'll go with it.
I think, yeah.
What do you
I don't know. I think it's just hard to, like, I don't know how realistic it is, just depending on like what sport and what level you're playing at and how often you're practicing. Like, if you're practicing 5 days a week and have games on the weekend, yeah, I'm sure you'd have time to throw this in a few days a week. But if you're only practicing like once or twice a week, you probably want to get as much out of it as you can with your sport specific stuff. So
Absolutely. Yeah, and I can just compare to what we wrote in our ebook, and I so agree with that, because good luck going to the clubs that we work with and getting them to do this much of it. I think it would be very hard to implement, at least straight away. So I think we need to. It's always good to critically analyze what they're doing, and at the end of the day, I think, which I can just tell you from my experience at the Saints, because this will be my 11th season at the club, and about 5 seasons ago, we implemented just dynamic. Up until then, they were still just doing like static stretch, have a kick, go back and static stretch and play. Good old days. And I was like, no, we've got to change this, and we add more dynamics. And it's embedded into their protocols. Jack, I'm sure you've seen them warm up. They're actually not bad at all. And they've actually been pretty thorough, which is awesome. But yeah, length of time is important, because if you're spending, how long would that be? 8, 10, what's that?
20
Even
minutes.
that's 18 minutes. That's already. And there's still another component, I think, at the end, isn't there, in part 3? Yeah. It's another 10. Jesus, that's 28 minutes.
No, I think it's the same one.
It's
Is that the same one? Oh, two, sorry.
20 total.
20 total. You know, for a game, you probably have elements to it. But just remember the implementation for sub-elite sports and thinking about what components are important to the sport. Like, the structure itself is awesome. I just, like Avi said, just wonder how it would be implemented at a sub-elite level.
Well, I think most teams would do at least that sort of first part in their warm-up. And then, you know, throwing in a Nordic and a bunch of like landing drills, adductor type work would definitely help, especially if it's you know, got pretty good results already. But yeah, I agree that, you know, 20 minutes of extra stuff is silly. But I think definitely, like, that's already done. That first part is usually done in most teams. But yeah, throwing in a couple of landing, a couple of Nordics, I think would be my take home point out of this.
Like, in saying that, I do like the structure, and I think doing the partner drills to then to the running, I think is really, really good. And I'd probably just have a little less, that's all. But let's see. Where I was just thinking as we were doing this, Jack, we need to probably we'll plan over the next 2 weeks to get to a few training sessions and actually do this with our teams. Once this ebook's done, so we'll talk. What great timing to review this, because we've just got to teach them how to warm up, because it's quite cold in Sydney, not America cold, but it's quite cold at the moment, Avi. So I feel like injury rates will definitely be impacted by that, you know, as well. So definitely something to get aware of. Yeah, really helpful. Anything else to go over, mate?
Not as such, no. I think there was just a short one today, but just if we can, it was just an interesting one to go over because of the timing and Cool.
Before we wrap up, then I'll just put Avi on the spot because I like to do that in these calls. Is there anything else? Your favorite part of the calls. Is there anything else you think we should either need to be aware of with our athletes before footy season, or anything else we should be screening in them to help them minimise the risk of injury and improve performance? I know it's a very long-winded statement, but just from your experience, yeah, there are other little markers, what things we should be just considering as we start to meet. Yeah.
I don't know. I think like concussion stuff.
Yeah.
Yeah,
I know that's not really along the same. It's kind of a different screening situation.
I was planning to do a concussion one of this in the next couple of weeks before we start.
Yeah, that'd be cool.
Yeah, we might even do that one next one. Yeah, we might even. Yeah, definitely. We might even do that next week and link it to a case conference as well. But getting baseline measures, I've been told, for concussion is actually really important. So I'd love to look at the evidence, and I've got I've actually got some cool resources. So remind me, Riley, to share them around. It's good for you as well. We'll do that. That would be cool. Yeah, that's a great one, because that's a whole other kettle of fish. We can talk about that another time. Did you ever get taught anything about just even nutrition, hydration, recovery, any of those little things? More as an athlete, more than a physio student now.
I mean, like we learned. I also was a nutrition major, so
that's right. Oh,
I learned a lot of that just in school. Yeah. But I'm trying to. It's kind of hard to remember if I learned it in school or. I mean, while I was actually playing, I don't know. They always say, you know, eat healthy, eat your protein, and whatever.
No.
Just like basic nutrition advice. Yeah,
I think they're just important just to relay to them hydration. Just give them all the 1%ers, as they say. No, that's cool. So that's actually given us some good thoughts. Do you want to quickly go around the room and just say the one thing we picked up and learned from it? Jack, do you want to kick us off?
Yeah. Well, I think it was just interesting just in incorporating the especially the Copenhagen exercise is shown to sort of decrease adductor injuries by like 40%. I think that's huge. Just with like a single exercise, I was saying. So I think that's another one that got me.
Yeah, nice.
I'll have to find that study.
Yeah, no, and please do. We'll look it up because we're going to talk about how to hit our clubs up, which is great. Riley, did you anything particular you picked up that you'd like to share?
Yeah, well, just like with the FIFA 11 thing, just obviously it's important to like have a bit of like dynamics during your like different things during your warm up and stuff, but just I don't think you need to do it like to that extent and stuff. Maybe try and build off that, but make it more sport specific, if that makes sense.
Yeah, no, definitely. And you obviously had a fair understanding of how to warm up, but hopefully that gives you a few other ideas for sure. Avi, what did you pick up?
I think that the middle section, this part 2 of the FIFA thing, was a good reminder to include core exercises and how like core stability is really important for injury prevention.
Yeah, absolutely. For me, I also was going to say the adductor stuff because it's stuff we can go and show our teams, core, adductor, Nordics. It's a great opportunity for Riley and Jack to actually create some content and be very clear in saying that risk of injury, which we'll talk about implementing later. But otherwise, thank you for jumping on.